Hello everyone! Welcome back to MJ Pharma. Today's topic, the drug of choice for common cardiovascular diseases, from hypertension to heart failure. We will cover the first-line medications you need to know in clinical practice. Let's jump in! Drug of choice for torsades de pointes. Magnesium sulfate. Drug of choice for dyslipidemia. HMG-CoA reductase inhibitors. Drug of choice for hypertriglyceridemia. Fibric acid. Drug of choice for myocardial infarction pain. Morphine. Drug of choice for mild hypertension. Diuretics. Drug of choice for the hypertensive crisis. Nitroprusside. Drug of choice for hypertension with BPH. Prazosin. Drug of choice for hypertension with ischemic heart disease. Beta blockers like atenolol, metoprolol, propranolol. Drug of choice for hypertension with diabetes mellitus. CE inhibitors like captopril. Drug of choice for hypertension with diabetic nephropathy. CE inhibitors, captopril, etc. Drug of choice for hypertension in young patients. CE inhibitors like captopril. Drug of choice for unilateral artery stenosis. CE inhibitors like captopril. Drug of choice for hypertension with renal disease. CE inhibitors like captopril. Drug of choice for hypertension and congestive heart failure, CHF. CE inhibitors like captopril. Drug of choice for hypertension and non-diabetic proteinuria. CE inhibitors like captopril. Drug of choice for hypertension and asthma. CE inhibitors like captopril. Drug of choice for hypertension in patients with ischemic heart disease. Beta blockers, atenolol, metoprolol, propranolol. Drug of choice for isolated systolic hypertension. Calcium channel blockers, amlodipine. Drug of choice for low renin hypertension. Calcium channel blockers, amlodipine. Drug of choice for hypertension with bronchial asthma. CE inhibitors or calcium channel blockers. Drug of choice for hypertension with chronic kidney disease, CKD. CE inhibitors like captopril. Drug of choice for hypertension preferred in older patients. Thiazides. Drug of choice for digoxin overdose. Digifab or Digibind. Drug of choice for Group B streptococcal infection. Ampicillin. Drug of choice for endocarditis. Amoxicillin. Drug of choice for digoxin toxicity. Potassium. First-line drug of choice for congestive heart failure. CE inhibitors, captopril and enalapril. Drug of choice for rapid-fast diuresis. Loop diuretics like furosemide. Drug of choice for multifocal atrial tachycardia. Verapamil, calcium channel blocker. Drug of choice for paroxysmal supraventricular tachycardia, PSVT. Adenosine, antiarrhythmic agent. Drug of choice for supraventricular tachycardia, SVT. Verapamil. Drug of choice for digitalis-induced ventricular arrhythmia. Lignocaine, antiarrhythmic agent. Drug of choice for ventricular arrhythmias. Lidocaine. Drug of choice for ventricular tachycardia and fibrillation. Lidocaine. Drug of choice for ventricular extrasystole. Beta blocker atenolol. Drug of choice for atrial fibrillation. Digitalis. Drug of choice for maintaining sinus rhythm. Amiodarone, antiarrhythmic agent. Drug of choice for Wolff-Parkinson-White syndrome. Procainamide or amiodarone. Drug of choice for digitalis-induced arrhythmia. Lignocaine. Drug of choice for acute left ventricular failure. I.V. furosemide. Drug of choice for the scleroderma-induced hypertensive crisis. CE inhibitors. Drug of choice for acute long QT syndrome. Magnesium sulfate. Drug of choice for congenital long QT syndrome. Beta blocker, metoprolol, atenolol. Drug of choice for hypertension with peripheral vascular disease. Calcium channel blockers. Drug of choice for the hypertensive emergency. Sodium nitroprusside, vasodilator. Drug of choice for malignant hypertension. Nitroprusside, vasodilator. Drug of choice for producing controlled hypotension. Sodium nitroprusside. Drug of choice for pulmonary hypertension. Bosentan. Drug of choice for atrial flutter and fibrillation. Ibutylide. Drug of choice for paradoxical tachycardia. Digoxin, digitalis glycosides. Drug of choice for angina. Nitrates, vasodilator. Drug of choice for prophylaxis of stable angina. Beta blockers like atenolol. Drug of choice for variant angina. Calcium channel blockers like verapamil. Drug of choice for diabetic dyslipidemia. Statins like atorvastatin, rosuvastatin. Drug of choice for dys-beta-lipoproteinemia. Fibrates, fenofibrates. Drug of choice for severe hypercholesterolemia. Nicotinic acid. Drug of choice for severe hypercholesterolemia. Rosuvastatin, statin. Drug of choice for lowering TAG levels. Fibrates. Drug of choice for lowering low-density lipid LDL cholesterol level. HMG-CoA reductase inhibitors. Drug of choice for the cardiogenic shock with renal failure. Dopamine. Drug of choice for rheumatic fever. Benzathine penicillin. Drug of choice for increasing high-density lipid cholesterol. Niacin. Drug of choice for pulmonary edema with congestive heart failure, CHF. Furosemide, loop diuretic. Drug of choice for rheumatic fever. Benzathine penicillin. Drug of choice for tetralogy of Fallot, TOF. Morphine. Drug of choice for reducing motility in congestive heart failure, CHF. Spironolactone. Drug of choice for inotropic effect. Dobutamine. Drug of choice for a hypertensive patient with benign prostatic hyperplasia, BPH. Alpha-1 blocker like prazosin, terazosin, doxazosin, alfuzosin. Drug of choice for perioperative arrhythmias. Esmolol, cardioselective beta blocker. This content is for educational purposes only. Always consult a certified healthcare provider before prescribing or using any medication. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.